We are here today with Susan Middendorf, who is going to tell us about her upcoming mission trip to Honduras. Tell us a little about your group and what you do on your mission trip to Honduras.
I travel with Dr. Pat, who works here in the Maumee, St. Luke's area, and we take a group of students. Many of them are UTMC students. We also have some from San Juan Bautista in Puerto Rico that will be joining us this year. So I go as a pharmacist to oversee the pharmacy students. They're able to do this as a rotation, and we're able to help the people of rural Honduras.
How many people travel with the group, and what are some of their backgrounds?
There will be about 76 people with us this year. So we're pharmacists, doctors, physician assistants, nurses, lots of different medical backgrounds. We do have a lot of family members. A lot of children come with us. If you're 12 years old and your mom or dad's a doctor, quite often we have a lot of students that help us out. And we all work together to have medical, and we even do surgical clinics.
What are you hoping to accomplish during this trip?
Well, my goal is I run the pharmacy, so I'm going to support the doctors that are having the medical clinic each day. The big purpose, in addition to education for the students, both pharmacy, med students, nursing students, is to help the local communities. We work with the Lions Club, and we take over the grade schools in very small communities, and that empowers the people to stay in their community, even though they don't have a doctor present, so they can keep living there. We also train some locals so they can take care of medical emergencies that might occur after we've left. We'll teach about cuts and first aid. We'll teach about how to birth a baby, some basic things like that, so that way it empowers the community to have more medical knowledge for themselves.
What is your history with this organization?
I originally started by donating to the University of Toledo to help out the medical students and the pharmacy students with scholarships, because the flight's pretty expensive to get to Honduras. And about 5 years ago, they needed another pharmacist, so they reached out to me. And so for the past 5 years, I've been going down as a pharmacist.
What do you find the most rewarding about being involved with this program?
I really like teaching the students. So since there's so many laws in the United States, the medical students, the pharmacy students, they can't actually practice as a doctor or a pharmacist until they're licensed and certified. But in another country, they're able to talk one-on-one with actual patients, dispense actual medication. We're mostly doing ibuprofen and Tylenol and amoxicillin. And it's great to see them learn and their confidence increase. My favorite story was a girl that was helping out with a dentist, and a little boy needed a tooth pulled, and he was scared to death, and he said, "No, I want you to help me." And this young med student, sat by his side and held his hand and helped pull the tooth, and she wanted to be a pediatrician. And so that reaffirmed her that little kids will trust her to take care of their medical needs when she gets back to the States.
How can viewers learn more about your group and how they can help?
The website would be scorefat.com, or you can contact Dr. Pat's medical office. He's the one that coordinates everything for us, and it started with his father. His father used to do medical trips. They're both physicians, and now Dr. Pat has continued that tradition, Dr. Richard Pat.
Thank you for your time today.
Thank you so much. It was wonderful meeting you.
This is Annabelle Bucko reporting for the Perrysburg Digital Media Club.